silent heart attack is a term which is usually coined that patient had a heart attack but there were no symptoms. So actually it can be that there were no symptoms absolutely. Patient was totally asymptomatic and the heart attack happened, which led to the damage to the heart muscle. So because of which his heart function has come down. But actually speaking, the heart attack was not totally asymptomatic. So there were some symptoms which were mimicking like gas or acidity, which patient had at some point of time, but then patient ignored it, so it was missed for some time. But then if the same patient reaches out to a cardiologist and his heart function is checked by echocardiogram or his ECG is seen more minutely, it is found out that somewhere in the past patient had a heart attack. Probably that episode which was mimicking like a acidity or a gas was a heart attack. Now patient ignored it, so it was, again we'll label this event as a silent heart attack, but actually it was not silent. So this is a real phenomena which we should address here, that we should not leave all these symptoms and ignore all these symptoms, which in high risk patients or in patients who are more vulnerable can be expression of a heart attack. One, heart attack may be absolutely silent, which is a very rare phenomenon, or patient may be having symptoms like hyperacidity, some discomfort in the epigastrium, which is like a gas. Usually we get many patients in our outdoors, they complain that they ate something erratic outside and because of which they had a lot of gas one night and they were not able to sleep. So they were kind of moving out of the room and trying to have more air. So they were walking around for 2-3 hours and then they slept. Now this episode patient is attributing to some erratic eating and patient had some gas phenomena, but actually this may be a heart attack. So even symptoms like this, mild sweating, gas episodes, burning episodes, nausea like symptoms can be a heart attack. Any symptomatic heart attack is a severe pain in the front of the chest or in the left arm or in the neck area, associated with lot of perspiration or sweating, lot of ghabrahat. So this is a severe symptomatic heart attack. So patient knows something is happening and he immediately rushes to a doctor, gets himself examined or starts the treatment. But asymptomatic heart attack could be very minute symptoms which are being ignored. The problem with asymptomatic heart attack is, now since there are no symptoms or minute symptoms, the more chances that will be ignored and the consequences may be anything. So if the ignorance is there, the consequences could be sudden death. The consequences could be that patient will actually lose so much of the heart muscle, the heart function will go down significantly, leading to breathing discomfort for the whole life for the patient. So patient is devastated actually. Now that is where the more emphasis should be on the fact that we should not ignore or miss out the asymptomatic heart attacks. That the patients who are at risk of heart disease, patients who are smokers, patient who has a history of diabetes, patients who have a positive family history for heart disease, especially the heart disease hitting in some of the family members at a younger age group. So these are the patients at higher risk of heart attacks. If there are some atypical symptoms or minor symptoms like gas or acidity or some sweating happening in these subset of patients, they don't have to ignore this. Please go to a doctor, get a ECG done, and a simple ECG or 2 ECGs taken half an hour apart will detect whether the patient is having a heart attack or these are real gastric symptoms. And to top it up further, if the cardiac enzyme, which is a very simple blood test, if that can also be done, that will be a sure shot sign whether this is a cardiac, this is a heart attack happening, or these are purely gastric symptoms. Answer is clear no. So silent heart attack, gravity could be anything. So as I mentioned, the gravity could be sudden death. The gravity could be that although the heart attack is silent but patient has lost a big chunk of a myocardium, the heart muscle is damaged and which may lead to a congestive heart failure, which may lead to cardiogenic shock situations. So the gravity can be anything. However, yes, silent heart attacks can be mild also, but then if it is mild, all the more reason that those mild heart attacks will not be picked up, and it will only be picked up once the patient is getting a normal screening in the form of an echocardiogram. He is getting these tests done at some hospital. Now, once we say that a heart attack has happened which was not picked up and so called it was silent, the next episode, patient remains vulnerable for such events because already some heart attack event has happened. So that means patient has a atherosclerotic vascular disease. There are blockages inside the arteries of the heart. So they can always hit again. And usually we know from our knowledge, usually atherosclerosis is more extensive and it's not a single blockage. Single blockage has produced a heart attack, but there may be other blockages in other arteries also. And the patient remains at quite a moderate to high risk of recurrent events whosoever has had this silent heart attack. The heart attack should be managed as we manage any heart attack. So if the patient arrives within a window of 6 to 8 hours of the heart attack, then obviously the best form of therapy is that we should take this patient to cath lab urgently, do the angiogram and open the culprit vessel to salvage the heart muscle at that point, to stall the heart attack at that point only and salvage the heart muscle. If the window is beyond 10 hours or 12 hours, then we can actually take the help of all the injections and all the medication required, the blood thinning medications, the statins and beta blockers. So all these medication remain the mainstay for treating the heart attacks beyond a certain window. This is the cornerstone, I would say. This is the key area. So role of regular health checkups. Now once we are saying that it was a silent heart attack or heart attack with minimal symptoms which was missed out, those heart attacks will be picked up only with the regular screening of that individual. So again, it comes to a point, a strong emphasis on the fact that patient should have a regular screening test at a regular intervals, 6 monthly or 1 yearly. Especially I am talking of individuals who are at risk, who have more risk factors. They should be screened at regular intervals, and on regular intervals it can be compared also. Suppose there is an echocardiogram test done on a patient 1 year back and the heart function was normal, and now the patient lands up after 1 year again for the screening test, and now it is found that heart function has gone down to 40%, and there are many patients in our OPDs like this. From 60% has declined to 30% or 40%. That means in the preceding year patient had some cardiac event which has led to this heart damage.